This segment is brought to you by the Southeastern Spine Institute.
Welcome to Southeastern Studios, where we learn about the latest medical technologies and sit down with physicians who are prominent in their field. All right, I'm back again today with Dr. Thomas Anderson from Southeastern Spine. How are you doing?
I'm great, thank you.
Wonderful. Now, why don't you tell me a little bit about some new technology that you've been working with?
So one of the things that we've been doing over the last couple of years that's exciting is artificial disc replacement. And we do that in the cervical spine, the neck. And it is a way to essentially recreate what nature gave us, which is the discs between the bones. And as many people know, over time those discs can wear out. And there's been technology developed that we use almost every day to go in and do a small, minimally invasive surgery to replace that disc and restore function.
And that's a really big thing with these surgeries, is the little small incisions, so then you can have better recovery time.
Definitely, and we call that minimally invasive surgery, and basically it means a small incision, but it also means trying to disturb as little tissue as possible when we're doing the surgery internally, and that does promote better healing. One of the things that most people don't realize is that minimally invasive surgery also dramatically reduces the risk of infection after surgery, which can be, a serious complication.
Absolutely. Now, I'm very curious what this material of these artificial discs are made of to mimic our human structure.
Good question. And they are made up of titanium, which is a type of metal, and as well as a special grade of surgical plastic that's been tested. Very interestingly, they have essentially robots that test these devices and put them through many, many thousands of revolutions that mimic the movement of the neck, and so they can predict that they're going to last a lifetime for patients without problems.
Wow. Now, what would you say is the most rewarding part of being able to treat these patients that come in with pain and can walk out, feeling much better?
Well, I think the most rewarding thing is having the patients come in, and when they've completed their recovery and they let us know that they're back to their old self, or they're doing things that they haven't been able to do in years, riding horses, walking, fishing, these types of things that really give people enjoyment. And many times they tell us that we changed their life.
And I do have one question. If you have any tips for people for preventing injuries or strain on your discs, obviously some things are inevitable, but...
Right. I always tell people to use common sense. Try to avoid really aggressive, heavy or repetitive lifting, bending, or twisting. Most people know that there are appropriate ways to lift and bend and twist, and of course we can teach people those things. They can also learn those things from doing a little research online or seeing a physical therapist.
All right, well, thank you so much. I appreciate it, Dr. Anderson, and if you guys want more information, you can go to southeasternspine.com. Thanks for joining us for another segment with Southeastern Studios, and as always, you can learn more information at southeasternspine.com.